Good morning. My name is
I think
Burton
there we
Tabaac,
go.
Burton Tabaac. Ladies and gentlemen of the Interim Judiciary Committee, I'm honored to join you today to discuss the potential benefits of supporting psychedelic therapeutics in our state. As we navigate the landscape of mental health, it's crucial to consider innovative approaches that may offer relief to those in need. Psychedelic-assisted therapies have shown promising results in addressing mental health conditions such as PTSD, depression, anxiety, and addiction. Rigorous research conducted at some of the country's top academic institutions have indicated that therapeutics including psilocybin, MDMA, and ibogaine, when administered responsibly, can contribute to significant improvements in patients' well-being that is sustainable and long-lasting. Moreover, supporting psychedelic therapeutics aligns with the growing national trend towards mental health awareness. By embracing progressive solutions, our state has the opportunity to be at the forefront of this transformative movement, fostering a compassionate and forward-thinking approach to mental health care. In terms of safety, it's important to emphasize that psychedelic therapies are administered in controlled settings by trained professionals. This ensures a secure environment, minimizing any potential risks associated with these treatments. Novel safety data has shown that, contrary to 1960s reports, psychedelics do not carry toxicity nor lead to dependency. Schedule I drugs are substances or chemicals defined as drugs with no currently accepted medical use and a high potential for abuse. This is clearly a political designation rather than a medical one. Additionally, the economic implications of supporting psychedelic therapeutics should not be overlooked. By investing in these alternative therapies, we can stimulate job creation within the healthcare sector, supporting the growth of specialized professionals and contributing to the overall economic well-being of our state. The cost to the system for current failed drug policy can also not be understated. As we consider the positive impact on individuals and communities, it is imperative to acknowledge the changing societal attitudes towards these treatments. Public perception is shifting, and embracing psychedelic therapeutics reflects our commitment to evolving with the times, respecting the latest medical evidence and prioritizing the mental health of our communities. Supporting psychedelic therapeutics is not an exploration into uncharted territory. It's an investment into the well-being of your constituents. By endorsing the aim to investigate psychedelics and delineating appropriate pathways to sustainable treatment, we have the opportunity to signal our commitment to progressive, evidence-based approaches to mental health care, positioning our state as a leader in fostering a healthier, more compassionate society. I am confident that together we can pave the way for a brighter future in mental health treatment within our state. I attend today as a neurologist, clinical associate professor, medical researcher of psychedelics, and advocate for the advancement of knowledge to challenge stigma and answer your questions on the potential of psychedelics to heal. I am eager to compare the current standard of care to psychedelic therapeutics, clarify any misconceptions dating back to Nixon-era misinformation on the war on drugs, and share the latest evidence of why psychedelics work, underscoring safety and highlighting a pathway to regulation that has medical support. Thank you for your time and consideration.
Thank you to all four presenters. We do have some questions. The first question will come from Carson City from Assemblyman Gray.
Thank you, Madam Chair. Good morning, Dr. Tabaac. Question for you. My family has dealt with this. I actually lost a brother last year to drug addiction, lifelong, constantly searching for a way to self-medicate his psychological problems away. Won't go into that, but I'm also a veteran and have seen firsthand the devastation on veterans having to deal with PTSD and the suicide issues that go along with that. Looking at our jails and our prisons, we have got so many people sitting behind bars for crimes related to drug use and drug offenses. not going to get into the question of, whether they should be sitting there or not. That's for courts and juries to decide based on the laws we have. What I'm wondering is, does the science show, one, are these substances addictive? I mean, are we just going to replace, one addiction with another? Two, what does the science say about actually treating drug addictions, and can we get them off of everything, if the right protocol is followed? And three, what was my third one? Would this be considered a gateway for any other kind of drug? That's my question. Thank you.
Thank you so very much for your question. I'm sorry for your loss, and I appreciate your listening ear. Psychedelics, interestingly, not only do not lead to addiction, but they have the potential to treat addiction. When someone is abusing an illicit substance, often they're using that to self-medicate, as you emphasized, and that pathway is often treating the symptoms of an underlying struggle or mental illness. Psychedelics get to the core root of a problem and allow people to think and reassess, to shift their perception in a different way. If you think of your mind as a snow-covered hill in which your thoughts are sleds, over time, the grooves are dug deeper and deeper, making it difficult to escape the paths that are created. And then these paths become ingrained. Psychedelics allow for a fresh mound of snow, so to speak, to be laid so that new paths, thoughts, and connections can be made. And this is a potential way to consider how psychedelics are effective at treating the ruminating thoughts and loops that are fostered through states of depression, anxiety, and addiction. In just one study that was conducted at the Johns Hopkins University, people who were addicted to nicotine and smoking cigarettes were enrolled and given one dose of psilocybin. And from that study, at 1 year follow-up, more than half of the enrolled participants no longer were addicted to smoking cigarettes, and that is the most successful smoking cessation treatment ever studied. Currently at Johns Hopkins, there is another trial that is currently recruiting patients to investigate the potential for psilocybin to treat opioid addiction. And already in the past several years, there is substantial evidence to support psilocybin as being very effective and safe at curing, and we don't use that term in medicine often, but curing alcohol addiction. Thank you for the question.
Madam Chair, I have a follow-up, please.
Yes, please.
If we could we get copies of those studies sent to the committee? Would love to see those. And for the record, like I said, anything we can do to cut down that 22 a day, it's worth looking into. As a staunch conservative, as my fellow compatriot there, my friend, the Navy SEAL, this is kind of outside our wheelhouse usually, but we care about our brothers and sisters, and we're willing to do anything we can to help save them.
Absolutely. I'd be very happy to share those studies with you. Those articles are open access with impressive statistical significance, and I'll be sure to make sure that you receive them.
Thank you. And can you actually send those to the committee, and then that way all the members will have access to them? Thank you for that. Our next question is from Assemblywoman Gallant.
Thank you, Chair. First of all, Dr. Tabaac, I have to say that was the best analogy I've ever heard on the brain pathways and the snowfall. So thank you for that. That was amazing.
You mentioned something when you were talking about basically the recreation of synapses. And so I was wondering, that was one part that I had not known before. That was interesting, knowing that they decrease, of course, as we age. And so I was wondering, has there been any studies or research done on neurological diseases such as Alzheimer's, Parkinson's, things where basically like a jump start back to our brain would be necessary?
I'd like to add to my colleague Dustin Hines' response in regards to clinical applications beyond the mental health realm. The preclinical model that Dr. Hines is pursuing looking at Alzheimer's is quite fascinating. To add to that, the latest evidence is progressing in human models as well. I think it's really important to underscore the concept of what a critical period is. This was a groundbreaking paper that was published in Nature, led by my mentor, Dr. Gul Dolan, who just signed with UC Berkeley. A critical period is a time window that is often readily open in infancy and childhood, where learning can take place. There's all different types of critical periods. There's one for language, one for vision, and then over time, that window closes, and there's pruning of the neuronal pathways. So if you take a child, for example, that's born with cataracts, and you wait until they're 9 or 10 years old to intervene with a surgery, they will remain blind because that critical period for learning vision closed. What this groundbreaking, paradigm-shifting paper in Nature showed is that all psychedelics reopen critical periods to allow for relearning. It reverts the brain back to a nascent state akin to that of childhood, which can promote profound healing at an organic cellular level beyond just shifting perception, which is what we see in a psychological perspective. And the implications expand beyond neurodegenerative diseases like Parkinson's and Alzheimer's. And there's work being done to look at, for example, ibogaine to treat traumatic brain injury and psilocybin to treat stroke. So to have Nevada support and approval of research pathways and other measures of regulation to investigate this can benefit such a large population of patients and loved ones.